shoulder blade area, yeah.
So we have Victoria here today, and she lives in New York City. She's a dancer. What do you want to look at today? What hurts?
My entire left side, from my shoulder blade and all the way down to my knee.
Okay. And did you do it recently in rehearsal or
It's been
class?
getting worse and worse a couple of months now.
Okay. So you get the left side neck, but it also hits your shoulder blade. Here, turn this way, please. All through here, right?
Mm-hmm.
And then how's your lower back? Same?
Not great, yeah.
Okay. And then what's going on with the lower leg or knee or something?
I feel like my hip is stuck, and then the past few days I've had a sharp pain in my knee.
Here, turn this way. So it's the inside of your knee?
Yep.
Here, lift this up if you can. And so we're talking about
Like
right there.
Yeah.
Okay, on the medial knee. All right, let's take a look. But in the meantime, I want to try something, okay? So here, face me. And turn just a little bit. And keep your arm firm. So make that strong. Good. And now tilt your head sideways like this. Here, watch. Just like that, towards the left side. And hold your arm. Goes weak. And keep it away from there. Hold your arm strong. Tilt it this way. Weak. Do you feel the difference? Yeah. All right. Let's have you lie on your back first. And so, here, I'll set you up. So, lie on your back with your head here. So, you'll be face up. And so we're going to look at that spot on the left first. It's this whole chain.
Yep.
It's from all the way up here. So first I'm going to stretch you just a little bit. So I'm going to stretch and create a little bit of a stretch. And you can see where I'm stretching right there. Bring it back to the center. I'm going to dig in here with my thumb. And again, stretch, stretch. Yeah, so these are all tight in here. Do you feel where my thumb is going?
Yeah.
Yeah, I'm pointing right there. And up here at the top, right?
Yeah.
So right at the top, it's really nasty. I bet that's where you heard it first. And then it just spread.
Yep.
Okay. Yeah, because right there is where I'm going to go first. Good. Wow. I'm going to pull straight back now. Do you feel anything pop on there?
Yeah.
How far down?
Like shoulder
Mid-back.
blade area, yeah.
Good. What do you think of that?
Wow, that was a lot.
All right, come stand. And put your feet right there. And then step forward a little bit. How does it feel so far?
I'm a little dizzy, but feels
Well, catch your breath.
a lot looser. Yeah.
Okay. Did that feel like intuitively like that was helpful?
Yeah, it did.
Or did you feel like you want to run out the door
No,
and not come back?
no, that was great.
All right, so let's try this again, okay? We're going to just repeat the same thing. So keep your arm firm and your head's just neutral. And now tilt your head this way. Hold. And now tilt it this way. Tilt it this way. Good. So we got some of that, what people call a pinch. We got that pinch out of there because it was really interrupting the body's ability to perform.
Yeah.
You know, the muscles need the nerve supply, and it was just sabotaging that whole thing. So there's more to do. Let's have you lie face down for a minute. So very often I like to work from the feet on up, but in your case, I don't know why I'm doing this. I'm going more top to down. But I'm really curious about all this stuff. Do you feel how nasty this is?
Yep.
So turn your face to the left, or this side. And when you turn that way, where do you feel it still? So I released a lot on the left, but reach your hand up and point to where you feel it's still stuck.
I don't really feel.
It's not so stuck anymore,
It's just,
right?
No, but it's just.
Yeah, so
tense.
that's a tense spot right there. So I'm going to just do a few of these that pop out at me, okay? So these are just kind of little articulation points where the rib meets the side of the vertebra. And that's called a costo. Costo means rib. Costovertebral joint. And now turn your face all the way to this side. How does that side feel?
Better.
Okay, good. So head back to center. I'm going to do a few spots in here, okay? Big breath in and blow it out. Big one, right? Mm-hmm. Good. So lift this leg as high as you can and put it back down, and then lift this one. Good. And then go back to the left because I helped you. And which one's harder to lift?
Oh, the left for sure.
And I want you to lift it this time and then dig your finger in where you feel it the most. So where's it restricted? It's the lower back. Okay, so lie on your side facing me. So I'm going to give you a pillow for under your head. Come close to the edge here. Pull up just the top knee. Let me take this arm and pull it through. And kind of tuck this under just a little bit. So it's going to look like this. So push this under. There you go. Keep coming. There we go.
Oof. Yeah.
So lie face down again. I'll give you another piece of paper. And lift that leg again and see if you still feel it as much.
Oh no, that's way better.
Way better, right?
Mm-hmm. Yeah.
Good. So turn to the other side. And let's just do a little more on this side. Pull this knee up like this. Scoot your hips towards me. You still have that internal left knee I'm thinking about. Yeah. Let this roll. Got it. So there's just one more on that side. So now lie face down. I'm going to turn this paper around for you, okay? So slide down, slide down, slide down, and pick your chest up so this can go on top. Now crawl back up and get your nose in there. Perfect. So left knee. Mm-hmm. But I think the hip is part of it.
Probably,
I think this hip went out first. Mm-hmm. Or it started to get irritated. Yeah. You feel that when I grab that thing? Mm-hmm. All right. So now I'm going to roll your hip out just a little bit. One more. Good. Now I'm going to do a couple of fine-tuning alignments on your knee, okay? Mm-hmm. And then we'll be done. How do you feel so far?
I mean, my back feels amazing.
Good. And your neck? Getting there.
Yeah.
The neck's going to take a little time because the muscles were so seized up and stiff.
Yeah.
But at least I got it released. Mm-hmm. Your legs are totally balanced right now. Okay. When I roll your hip like this, that internally rotates your hip, and then it makes the leg go short. Mm. So that means there's something going on with the rotation of the hip. And I'm going to take out internal rotation, and there's a little bit of an anterior movement as well. And now I'm going to recheck it, and it's balanced. Mm-hmm. Good. So the next thing I'm going to do is I'm going to stress the knee forward. Mm-hmm. So I push on the tibia forward. No reaction. I pull it back. No reaction. I grab the fibula. No reaction. I do the valgus varus checks. Those are fine. I check the medial collateral ligament. That's off. Okay. And it makes sense because you had that medial knee pain, right? Yeah. Wow. So this is kind of right there. Can I pull this leg up? Yeah. I don't know if it will go up that high. Mm-hmm. Yeah, it does. All right. So I'm right here where it hinges. And you feel how tender that is? Yeah. It's bad, right? Yeah. So I have it on a setting that's appropriate for the knee. And I'm going to adjust right down in there. And I'm also going to get the inside of the ankle. And the leg goes even. I push up, which is opposite of what I did. It stays even. I'm going to also compress the knee. I like it. So come stand, see how it feels. Now the knee is inflamed, so you should ice it. But let me take these things off. And but I don't want you to. I want you to see if it feels like it's tracking better, because that's the first step of it getting better.
Mm-hmm. Yeah, it does feel better.
All right, so it has a chance to heal in the next couple of days. Mm-hmm. I would totally ice it. Yeah. Have it on for 10 or 12 minutes, and then have it off for 30 to 45 minutes. Let it go back to normal. The skin should feel like you didn't put ice on it. Okay. And then you can put ice on it again. All right?
Yeah. Thank you so much.
You're welcome. Thank you.
So much.